We are live.
So, good evening, dear Foxians and all viewers watching this special episode of Foxy Gyan Pravah series daily podcast. I am Dr. Brisbala Tiwari, Chairperson of Environmental Health Committee Foxy, and it's my absolute pleasure to welcome you all to this 183rd episode of Inspiring Knowledge Initiative. Today's episode is of great relevance not only for healthcare professionals but for every citizen who are concerned about the health of our planet and all living organisms. We are honored to have with us Dr. Arvind Kumar, sir, professor at Medanta Institute. He is renowned senior lung transplant surgeon and a passionate climate warrior. He has been a powerful voice advocating for clean air, and today he joins us to speak on air pollution and health hazard. Doctors for clean air, health professional should be climate advocate. As someone said, the environment is where all we meet, where we all have a mutual interest, and it is the one thing all of us share. Dr. Arvind Kumar truly embodies this spirit through his tireless efforts. He reminds us that protecting public health begins with protecting the air we breathe. This Gyan Pravah series is part of a landmark initiative by our beloved Foxy President, Dr. Sunita Tandulwadkar Madam, a meticulously curated daily podcast inviting subject experts from diverse fields to empower us with knowledge and insight to uplift women's health and well-being. Is the core of this visionary project stands out phenomenal leader Dr. Sunita Tandulwadkar Madam, President of Foxy. It is now my privilege to introduce her to grace the session. As someone said, a leader is one who knows the way, goes the way, and shows the way. Dr. Sunita Tandulwadkar Madam is that kind of leader, visionary, compassionate, and action driven. Madam is a global luminary in obstetrics and gynecology whose
Rishbala, it is
has the
your day with Professor. That's okay.
just madam few things. Madam is president of Foxy, which is the largest association of medical professionals. Madam is past president of Indian Association of Gynae Endoscopy and president-elect for ISAR, founder president of Society of Ovarian Rejuvenation. Ma'am has pioneered stem cell therapy in infertility and credited with the world's first birth through ovarian rejuvenation with stem cells. And Madam has been decorated with many awards. Few I will call
Thank you,
President.
Rishbala. Thank you. Let's continue for
Madam,
the
need your
podcast
blessing for
because
today. Yes.
thank you. Thank you, Brishbala. And thank you for having Professor Arvind Kumar with us. Sir, please welcome on the Foxy platform. You are doing amazing work, lung transplant surgeon, and working on an environment. Both are absolutely the need of it today. I also have regenerative, sir, and wellness, and I know how much environment pollution and all the dust particle. We do lung regeneration programs with us, and it is such a pleasure to have you. And I think it will be great pleasure to listen to your podcast, your views, and how you are helping. So this is what is very important. You are in your field with the excellence, but you are devoting your time on some factors which are of social importance. And that is very touching, sir. So thank you for coming on a Foxy platform. And thank you, Brijbala, coming with such a wonderful faculty for the podcast. 180 plus podcast every day, 8 p.m. is a very, very important landmark event for us. And we are going to have a 365 uh, podcast. I know when we started, I was thinking it is very challenging, but all my committee chairperson, they always come out with the brilliant faculty and the brilliant dialogue that these all everyday podcast is much cherished Foxy treasure, I will say, at the end of a year. Thank you. Thank you, Rishbala, and I have a wonderful dialogue with him.
Thank you, madam, for inspiring all of us. And you're so instrumental with so many projects Foxy is doing under your leadership. We are so much thankful
I
to you,
am,
ma'am.
if you see, I'm taking my IV therapy here. I am with my IV drip and all because
You are so much devoted with Foxy that you're joining with this. I'm so grateful to you, ma'am. Thank you so much.
thank you. Thank you. Lovely talking to you.
So, thank you so much, ma'am, for this opportunity. And now I welcome our guest speaker, Dr. Arvind Kumar sir. Sir is an eminent lung cancer and transplantation surgeon from Delhi, Gurgaon. Sir has pioneering work, many research papers in international and national journals, a leading voice in air pollution and research, and the founder of Doctors for Clean Air and Climate Change. That is really inspiring. Sir, his pioneering work and highlights how air pollution is not just an environmental issue, it is a global health crisis. As clinician, our role extends beyond the clinic. The health of everyone, an unborn child, is directly impacted by environment they live in. Today, we will be discussing why every health professional must step up with a climate advocate in how our collective voice can drive. So I welcome you, sir, and
Thank you.
I'm so thankful for sharing your time. You are doing so long surgeries whole day. You are busy in OT, and I was troubling you, and you had given me this date long back, sir. So thank you so much,
Thank you.
sir. So
Thank you, sir. Bye.
thank you, ma'am.
Our
My gracious.
our thank you. Our way, sir. Now I'll join the viewers link to listen to both of you, and you only both of you will be in the framework. So
So
see you from other
before you
side.
sign off, Dr. Sunita, allow me to convey my first of all congratulations to you for becoming Foxy President One, two for this lovely
Thank you.
initiative of a podcast a day. I mean, how could you even think of this? A podcast a day. I mean, we also do podcast in our Surgeons Association, but not every day. So
Sir, I have
congratulations
a
for this.
30 committee chairpersons under
Sure,
me,
sure.
and whenever
So
there is a 31st, it is me who takes over the podcast.
wonderful. So, congratulations for this brilliant initiative. And also, it speaks volumes about your dedication that despite receiving an IV drip, you are still sitting and smilingly welcoming your guest. That really speaks volumes about your professional commitment. Hats off to you, and I wish you good luck, a speedy recovery from whatever you are suffering with requiring IV fluids. And of course, I look forward to this podcast. And thank you, Dr. Brajbala Tiwari, for inviting me to this podcast.
Thank you. Thank you. Thank you, sir. Lovely. And definitely looking forward to see you sometimes in
Sure,
person.
sure. Likewise.
Thank you.
Thank you, madam, for your gracious presence. And now we will start a discussion with very eminent and thoughtful lung transplant surgeon and very senior Dr. Arvind Kumar sir. And sir had been in AIMS previously. Now sir is heading as chairman of lung transplant unit at Medanta Hospital, Gurgaon. And sir, you are doing pioneering work and as a leading lung surgeon, cancer surgeon, transplant surgeon, how your clinical experience shaped your interest in respiratory health beyond the operating room? And what make you inspire to, what was the turning point made you realize that air pollution more than just an environmental concern, but a direct health hazard? So want to know about the formation of Doctors for Clean Air and Climate Change. What was the vision behind this movement?
Yeah.
So
So
I'm
once
really
again,
eager to know.
sure. Once again, thanks, Dr. Tiwari, and to Dr. Sunita, and good evening, all Foxy members from across the globe. Thank you so much for having me on this very important topic. So the I'm a, as you said, I'm a chest surgeon. I started my career as a chest surgeon way back in 1988 at All India Institute. I was there till 2012, and thereafter I moved to Gangaram Hospital. I was there for 8 years, and then 2020 I moved to Medanta, and presently I head chest surgery and lung transplant department there. So as a part of my uh, my subject, I open 2 3 chests every day, get to see the lungs with my own eyes. And from 1988 to about 2013 or so, over this nearly almost 25 plus years, I noticed a subtle but very definite change in the color of the lungs of people. So, way back in 88, when I used to see lungs, smokers used to have black lungs, but non smokers, people coming from hilly areas and people coming from rural areas, they used to have pristine pink lungs. But around 2007, 8, 9, 10, 11, 12, very slowly but surely, I was noticing that it's becoming a very uncommon initially and rare later for me to see any pink lung. Most of the lungs, whether it's a smoker or a non-smoker, city dweller or a villager, hilly area, plains areas, everybody was having more or less black deposits on the lung. And this started worrying me. What has happened? Why has the color of human lung changed? In between, I used to make trips abroad, and when I would see people in US, only smokers would have black lungs, otherwise non-smokers would not. So their thought started hitting the mind. Why is this happening in Indian lungs, and I'm not seeing it in the lungs in people in US? So immediately my mind started correlating it to air pollution exposure, because there was no other cause to explain the difference in non-smokers. And the turning point came around 2015, first half, when I saw a few children, in early teens with black deposits on their lungs. And it hit me badly that if in early childhood, these children are having such black deposits, what will happen to their lungs by the time they reach 30s or 40s, if at all they reach 30s and 40s? And that was a moment of reckoning. And I was sort of very confused and very disturbed, perturbed. What should I do? How should I just remain silent that, okay, my job is as a chest surgeon to operate. I should operate and be quiet. Or this silent revolution, bad revolution, which I'm seeing, I should bring it out and bring it to the notice of the world. So their answer came from inside that no, it would be wrong if you keep this information to yourself and don't share it with the world. So I took pictures, since I do thoracoscopic, the chest equivalent of laparoscopy. So we were in a position to record those videos, record the pictures of those lungs, and I got those pictures into my slides, of course, in a without naming the patient. And then I said that, well, this must be shared with people. So three other people in my close circle, I talked to them, and four of us, we said that, okay, let's form an NGO and start sharing this information with people, because I couldn't have done it under the hospital platform, because then so many permissions and other things are required. So four of us formed Lung Care Foundation as a NGO on 25th of May 2015, with the sole aim of empowering people about the health ill effects of air pollution, what are the other threats to the lung health, and how can you promote your lung health. And when we looked at our logo, we made lung in between, and we made those dole shole, the baju, the arms, healthy arms on both sides of it, conveying that this NGO stands for happy healthy lungs. So that's how we started this. And to begin with, we started addressing school children. We started going to schools, MCD schools, private schools, and we used to address children in a very playful way. We used to have a program called Aao Khele Doctor Doctor. So I would take a few stethoscopes, have the children in a hall, and distribute the stethoscope ki, okay, bachcho, aap log doctor ho, you are doctors and we are patients. Come, put the stethoscope on your ear and auscultate our chest. So for about 15 minutes we'll do this playful activity just to grab their attention, and then we'll say, okay, now playful activity is done, let's talk something for 10 minutes. So then I will show them these slides of pink lungs, black lungs, and tell them that what little things they can do in their house. Tell your mommy not to burn chula. If she's using in the cooking chula, then ask your dad to put a exhaust fan there. If your dad or your granddad is smoking inside the house, or they are using the chillum, etc., ask them not to do it because it harms. So little health related, lung health related informations we started giving them, and this started giving a lot of traction to us. But our turning point came in 2017, when one of our trustees, Abhishek, who's actually an engineer but interested in this work, he said, let's do something big, which attracts the attention of the whole country. And when we were deliberating, we hit upon the idea that, okay, let's create a Guinness World Record for human image of lung. So, Dr. Tiwari, we had 5,000 children from 35 schools across Delhi assemble in a stadium on 23rd of December 2017, and they formed an image of lung by putting in ponchos. So we had trachea, bronchus, and the two pink lungs created. And on one side, so initially they were wearing pink colors overalls. So from when you look at from drones, it looked like pink. And in one lung, we asked the children to remove the head part, the hood part of it. So the hair looked black. So that lung became black, and the other lung, the people continued to have a hood over their head. So it was pink. So that's how pictorially we showed to the world how this is happening. This actually was the turning point because it got global media attention. And then suddenly those black lung, pink lung images, which we released along with this, it went all over the globe. And this got me an invitation to come as a guest speaker to the first WHO conference on air pollution and health, which was held in October of 2018 at Geneva. So this was the power of this one activity where, as a doctor, we could show to the people how air pollution is destroying the lungs. So this was the story how Lung Care Foundation took shape. The second part is how did we develop Doctors for Clean Air? And there's a small interesting story. When I went to Geneva, I took these pictures of being pink lungs, black lungs, etc., etc. And it was a 12 minutes keynote address there. Now, before me and after me, there were big scientists who had devoted their life doing great work on air pollution. Their lectures were appreciated. But when I gave my talk, after the talk, for 5 minutes, there was a continuous clapping in the hall. So much so that my slides were repeated. They asked me to re-put the slides of black lung, pink lungs. People took pictures, and within 15 minutes, those pictures went all over the globe because there were 500 people from across the globe. Now, that was the moment where, and then I asked people that, you have heard such big scientists give their deliberations, whole lifetime of work they were presenting. I said, I have only shown the picture, but they said that this picture has hit us so badly. And somebody said, oh, I'm just imagining how my child's lung will be looking. I'm imagining how my grandchild's lung will be looking. So that was the moment, Dr. Tiwari, where I realized that air pollution is not a chemical issue. It's a health issue. It should not be addressed by environmentalists or scientists. It should be addressed by doctors. Then only it will get the attention that it deserves. So as soon as I came back from Geneva, I just contacted my group and we formed this organization within Lung Care Foundation called Doctors for Clean Air to harness the power of doctors from across the country, across all disciplines, to reach out to people and to tell them this is not about PM 2.5. This is about your child, your grandchild, his health, her health, your parents' health. And if you are concerned about your family, you cannot ignore this topic. So, Dr. Tiwari, this was the development of Lung Care Foundation and Doctors for Clean Air.
So much grateful, sir. So it was so like inspiring, so thoughtful approach you started from 1988 on, and you started this 2007. So over 20 years, you observed with your eyes and you saw the changes from pink to dark lungs, and then it was your passion, it was your care for the human beings, for everyone that bring this thing. And the approach you started, आओ खेले डॉक्टर डॉक्टर, बच्चों के दिमाग में जब ये 15 मिनट तक उनको स्टेथोस्कोप से सुनने को बोला, सर एक बच्चा जो सीख कर जाता है क्लासरूम से, he tells to all family, so that gives really good approach. That is the most appropriate approach you started, and the great initiative from 35 schools, 5,000 children making these pictures. Amazing, sir. That was the great start. And I can imagine the WHO in Geneva, your talk, because one picture says millions work
Yes.
word, and that was your own thing, that was your own work, and you realized over the time that this is the not only the elderly, not only the middle age, this is the young people are started suffering. So that is the great volume and great dedication. And then you thought that it is the doctors, medical professional, from there we should start. We should not look upon the government and other things. We should start from the charity begins from home, we can say. So you started your own, you took friends, you took other doctors, made a group, and Doctor for Clean Air and Climate Change. Very, very important thing for the human health, not only for human and for every living organism. It is going to affect all AQIs. Was like you were saying, not only in the Delhi area, NCR area, people living in rural area, people coming from even the hilly area are getting these types of, that was not uncommon and not rare thing to see the color change in the lungs. So
Yep.
amazing things. You started approaching from operating room to practice for the public health. Hats off, sir.
Thank you.
So, sir, we know that the air pollution affects the lung first. So, how prolonged exposure leads to chronic respiratory disease? Because we are seeing lot many patients with COPD, ILD, even in non-smoker, like you said, that not only in the smoker you found this type of color change, even in non-smoker you found this. So, how much time, how much prolonged exposure leads to all this?
Yeah. So that's an excellent question, Dr. Tiwari, that, okay, what are the health ill effects of air pollution? Most of the people, including many doctors, think that air pollution only affects lungs. The truth is far from it. Yes, lungs are the portal of entry because the pollutants enter through our nose into our lungs. But once the particulate matter and the gases, they go inside, they get deposited there. You know, we breathe 25,000 times in a day. An average adult breathes 25,000 times in a day, taking in about 10,000 liters of air inside in that 24 hours. So, in every breath, when there are particulate matter and gases going inside, even if a teeny mini fraction gets left inside, you can imagine over a period of months and years and decades how much is getting deposited. Now, these are chemicals which remain there and then they get absorbed from the lining of the lung and go into the blood. And through blood, they go to every organ from brain to toe. And that's the reason why today there is no organ in the body which escapes the ill effect of air pollution. It starts with lungs, so you have these black deposits. So in the immediate childhood, we find asthma to be the first problem which these children face. And we ourselves have done studies. Lung Care Foundation did a study in 2019, and we have just repeated in 2025, where we have gone to many schools in Delhi and done on-site lung health examination and spirometry of children between the 11 to 14 years of age, normal children, apparently healthy children. And we found 50% of the children to be having some respiratory symptom or the other: cough, sneezing, running nose, itchy eyes, etc., or soreness in the throat. 50% of the children complained of respiratory symptoms, and nearly 30% were detected to have spirometry proved airway obstruction, which in childhood is synonymous with asthma. That's a mind boggling figure, that almost one out of every three child in Delhi is having spirometry proved airway obstruction. And we attribute it to air pollution because we also did similar studies in children in Mysuru and Kottayam, which are relatively less polluted areas compared to Delhi. And we found less than half the incidence in those areas. So obviously this double incidence in Delhi is directly correlated to this. So it starts with bronchial asthma in children. It's one of the commonest causes of pneumonia in our rural areas, where the wood burning in the house is still common, although Pradhan Mantri Ujjwala Yojana has reduced it substantially. But even today there are households which burn wood, and that smoke, which has thousands of micrograms of PM 2.5, is inhaled by children and the pregnant ladies or ladies there, and they get all kinds of problems. And it's the commonest cause of mortality in under 5 children. As they grow up, they develop all kinds of problems. So there is reports now of stunted growth of the lungs. And when they grow up in the adults, you have COPD, you have ILD, you have higher incidence of tuberculosis, you have dreaded disease, lung cancer. Now, regarding lung cancer, I would like to share with you my own experience. So I've been operating on lung cancer since 1988. And I looked at my data of 1988 and looked at my data a couple of years back, 2 years back. And in this span of about 32 or 33 years, I have seen a huge change in the demography of lung cancer. So way back in 88, 95% of the patients were smokers, mostly men, mostly in 50s and 60s. Smoker, men, elderly. So it was known as a disease of elderly smoker men. But when I looked at my recent data, I was horrified to find that 50% of the patients today are non-smokers. 50%. 40% of the patients today are women. All non-smokers from non-smoking families. And the peak age from 50s and 60s is now down to 40s. 10% of the patients are in 30s. And the youngest I have operated is a 26-year-old boy. So there is a more and more cancer occurring in younger people, more and more in women, and more in non-smokers. So why is this change? From a smoker, elderly men, it has become as much in women as in men, as much in smokers as in non-smokers, and more younger people. So this has happened because from smokers disease, it has changed to air polluted air pollution affected disease. So anyone who breathes today is a smoker, because average PM 2.5 in most of the cities in India is around 100, which is equal to about 7 to 8 cigarettes a day. So I dare say that in a polluted city, there is no true non-smoker. And Dr. Tiwari, the saddest part is, which nobody realizes, that this exposure starts from your clinics. When you conduct deliveries for children and take out healthy babies and hand them over to the pediatrician, they give oxygen for maybe half an hour or so, and then the babies are handed over to the mother. And what air are those babies breathing? The same air which the mother is breathing, which all of us are breathing. And if that air has a PM 2.5 of 300, 250, 400, it's equal to about 10, 12, 15, 20 cigarettes. So I dare say that in a polluted city, the newborns become smokers from the first breath of their life because of breathing polluted air. They become smoker or have the same damage as smokers without touching a cigarette. So I have in my presentation a slide where the milk bottle is there, but inside the milk bottle, instead of milk, there are cigarette butts which are lying inside, and there is a small child, sitting next to that. So this is the damage which is that it affects brain, it affects heart, it affects blood vessels, it affects reproductive system, our eyes, and now there are reports to say that even diabetes and obesity are occurring in higher incidence in India because of exposure to air pollution. So I have a diagram of the whole body where all the organs are there, and it is written that no organ in the body escapes the ill effect of air pollution. And of course, we will talk about the impact on the pregnant ladies in the subsequent section when you come to that part.
So, sir, it is really alarming and very serious matter, and the misconception among people, even doctors, about the that it is causing only lung damage from COPD and lung cancer and ILD, etc. But it is the silent damage air pollution causes before symptoms, and it was right. Like I was shocked to hear it that 50% of school going children having involvement of lung in some or other form. In what the impression in the parents that child is having pneumonia, child is having childhood asthma, that is because of the this type of air pollution. And we feel relaxed like we are not having any smoker in our family, we are having no smoker zone in our hospital, but in spite of that we are exposed to smoking environment, and no
Sure.
one is non-smoker, not the passive smoking and all that. So, as you were saying, demographic, this number is changed from elderly to younger age, and you have operated 26, 27 year.
26 years old. Yeah. So,
So,
Dr. Tiwari, when I noticed this change in lung cancer demography, it was so horrifying. It was so stunning that my first reaction was maybe there's something wrong with my data collection. So I re-looked at data, and data again showed the same thing. But I was not satisfied because it was so disturbing that how can smoker and non-smoker all be having same incidence of lung cancer? How can we be having 40%? It's not, such massive change. So I called up my colleagues from cancer centers across the country, Mumbai, Kolkata, Chennai, Trivandrum, Bangalore. And I was shocked that they had same numbers to share. Maybe 5-10% this way. Somebody said it's 40, 60, somebody says 55. More or less, the trend was same, that we are seeing more and more lung cancer in non-smokers, more and more lung cancer in younger people, more and more lung cancer in women. Now, this is a very, very frightening scenario because it seems that pollution is there to stay. All of us who breathe are exposed to it and therefore are prone to develop this dreaded disease at any time. And unfortunately, 90% of the time, this disease, by the time it develops symptoms, it is in stage 4. And it is the highest mortality cancer. So, if you look at it from a public health point of view, it's a big volcano of health issue that we are sitting on.
so it's a very, very serious condition,
It's
sir.
a very scary scenario, Dr. Vari. Yes, true.
Every citizen, not only doctors, should be concerned and government should be concerned about. So this climate change is amplifying existing health challenges, definitely. And why should all health professionals, not just pulmonologists or environmentalists, as you said, should be concerned? You told us, but I want to know in more detail, sir, if you
Sure.
can.
Sure.
elaborate.
So, Dr. Vari, as you mentioned, there are two issues here. One is air pollution, which is pollution in the air around us, which we are breathing, and other is climate change. Now, climate, as you know, it refers to the weather conditions over a long period of time. That's what we call climate. And what is happening is that because of a large amount of CO2, which is getting released from various sources, mainly because of the consumption of fossil fluids. There is a huge carbon load up there in the upper atmosphere, which is trapping the heat. It's leading to global warming. And that is leading to serious consequences, which can be clubbed into different categories. And if you look at the magnitude of this problem, you'll realize that this climate change and global warming, which are related. Global warming is actually one of the symptom or one of the manifestations of climate change. So this is having far more serious consequences than air pollution. Air pollution is affecting us directly, but climate change, global warming is affecting environment. It is affecting food security. It is affecting the existence of the ecosystems, and very serious health consequences. If you look at last 5 years, Dr. Vari, you will realize the number of natural disasters, landslides, tornadoes, tsunami, earthquake. I mean, you look at all these natural disasters, look at the numbers in the last 10 years and compare it with what we used to read in newspapers when we were children. You'll realize there's sudden explosion in the incident. It is a direct effect of it. Today, you find snowfall in Rajasthan. Sometimes you find snowfall in Dubai, and then suddenly you find massive rainfall in Rajasthan, and then you have sukha or no snow in our hilly area. So it's all total change in the monsoon cycle, in the all the things, and it has serious consequences for the existence of mankind. Because if the planet is sick, we human beings cannot stay on a sick planet. But today, the planet is sick, and that's going to make us also sick. And that increases the importance that as health professionals, we just cannot be sitting quietly and thinking that, oh, government will do. Well, governments will do. They definitely will do. But we as individuals who are aware of this problem should act and should and must do whatever we can in our own way. I think that's our duty. That's how I look at it, Dr. Tiwari.
Yes, sir. It's an eye-opening scenario you just told that not only in NCR area, you discussed with your colleagues across India, in south, north, east, west, everywhere, even in hilly area, they are getting equal number of patients. Less 5 to 10% is okay, but so it is really very serious and alarming matter, and that's why you have started with Doctor for Clean Air and Climate
And
Change.
climate
So
change.
I can understand now. So, uh, coming to a reproductive health, sir. So we are seeing like in 90s when we started seeing our patient, the incidence of infertility and other things, reproductive, like precocious puberty, and all these were not so high as we are seeing now. And there are multiple studies that infertility and pregnancy complications and premature menopause are increasing. And there are studies that says that it is the air pollution, PM level, and they causing ill effects on human reproduction, not only women's health, but male partner. The male infertility is increasing,
Sure.
spermatogenesis is like the
Yeah.
whatever is the criteria of sperm, WHO sperm criteria, they have reduced the number to this is sufficient now, that was sufficient that. So how do you look into the this effect of air pollution on reproductive health?
Yeah, very important and pertinent question, Dr. Tiwari. Effect on reproductive. So, as I said, no system in the body is is saved from the ill effects, and reproductive system is no exception. Whether it is male or female, both are equally and badly affected. So as you rightly mentioned, from precocious puberty, early menopause, infertility, menstrual disturbances, a lower sperm count, decreased libido. Decreased libido is another very often being reported, which is again being linked to these particles. So what happens is that these particles, they get absorbed and their chemicals go to every organ. So they reach there. The other thing which goes with this is microplastics. When these plastics burn, there are teeny mini particles which are there in the air. And now microplastic particles have also been demonstrated in semen, in testicular samples, in ovarian samples, in placenta samples, in all organ samples. So all these play havoc, not overnight, but over a sustained period of time. Unfortunately, this exposure starts at birth and remains 25,000 times a day till we stop breathing. So it's a continuous process, and there is a cumulative toxicity which happens. So as your age advances, the toxicity goes on increasing. And apart from healthy adults, both male and female, and their reproductive organs, I think the worst affected segment, Dr. Tiwari, is pregnant lady. So when a pregnant lady breathes in a polluted city, those chemicals go into her lungs, get absorbed, and through the blood, crossing the placental barrier, they go to the fetus, and they harm the fetus in the first trimester, second trimester, third trimester, and at birth. And the consequences vary according to the time. So first trimester, which is the organogenesis, you have all kinds of congenital defects as well as intrauterine death, which is reported, which is all fact. It's not fiction. It's not a fiction, figment of my imagination. There is hard data to show that there are higher incidence of congenital defects. Then second, third trimester, there is intrauterine growth retardation, intrauterine death, premature delivery, and all kinds of perinatal problems. Even higher incidence of preeclampsia and eclampsia is now being correlated with the exposure to pollution. And then when the child is born, as I said, when he's taking first breath, he's exposed to that air. So bronchiolitis now is so common. When we were children, we had never seen nebulizers in our homes. But Dr. Tiwari, today, nebulizer and child is synonymous. Hardly any house which has children will not be having nebulizers. Even children say, gee, I'm feeling breathless, I'm going to get nebulizer. It's so ubiquitous. It's because of the exposure to air pollution. So I think when we come to pregnant ladies, it hurts them badly. Earlier, we used to say that, oh, you should not smoke. If you love your child, don't smoke. But whatever damage smoking used to cause earlier, now same damage is being caused by air pollution. Unfortunately, smoking could be controlled. We could stop smoking and save ourselves. But this is a menace that we cannot save ourselves from unless we do something to clean the air we breathe, which is exactly what Doctors for Clean Air and Climate Action is all about. Dr. Tiwari.
So, as sir rightly said, that it is the in utero exposure happens. Like we are seeing polluted placenta, and what we used to think there's some things are idiopathic, but they are having this etiology that they are not idiopathic. The PIH, IUGR may be due to this things are increasing. So really it is very disheartening, and in utero babies are exposed and they are coming with this non-smoking air pollution, and rightly said that it cannot be controlled. We can advise the person to stop, to quit smoking. Like I used to keep Garbha Sanskar and I used to call couple. And that time, mostly I'm asking them, if you are smoking, please stop smoking. For that, you are going to have new member in family. For the sake of new member, you can quit this bad habit. But in
Sure.
spite of that, they are exposed to this.
Now you can't do anything. You can't tell them to stop breathing.
Yes, we can't. We can't. We are helpless, and doctors and uh, pioneers and devoted personalities like you are doing great work in that way, sir. It is really eye-opening for me, and I think for all the viewers watching this thing. So, the most impactful campaign or the moments of advocacy, what have been your most impactful campaigns, sir?
Yeah. So, first thing is that we have tried to reach out to various associations, and because I travel across the country, taking lectures to various groups, I found, Dr. Tiwari, that there is a lot of lack of adequate knowledge even amongst doctors. We all say that public does not know the details, but even lot of doctors do not know the gravity of the situation. They all know that air pollution is causing lung problem, maybe heart problem, but from brain to toe, there is no organ which escapes the ill effects. It starts hurting us even before we are born. It starts hurting us from the time the sperm and the ovum meet and form the life. So from that point, it starts hurting. Now these aspects, Dr. Tiwari, are not known to people, and I think first duty for all of us is to make each other available. And that's why we have developed something called a clean air prescription, which is a small booklet we have developed, which I'll be happy to share with you. And you could share the e-copy with all your members across the country. It just gives some basic information. I call it Air Pollution 101, which means basic information. What is PM 2.5? What is PM10? What are the gases? What is AQI? It just defines, it mentions what are the immediate effects, what are the long term effects on various organs, and then it exhorts doctors to spare some time from their busy schedule and initiate dialogue with their patients. I call doctors as motivated motivators for the issue of air pollution. Why are they motivated? Because we see the ill effect. Why did you choose this topic? Because Dr. Tiwari, somewhere or the other, you must have seen the ill effects. Why am I so passionate? Because I see the ill effect. So all of us in our practice see the ill effects of air pollution. So that gives us the motivation to act on this. And when we talk to people that this is a health issue, suppose some child comes with asthma and we tell them that yes, asthma I'm going to treat, but gentlemen, the child is having asthma because of air pollution exposure, you have to do something about it. Then if a scientist tells him versus a doctor tells him, whom is he likely to listen? Obviously a doctor. A health issue can only be talked. So that's why I say when we talk to people, they will listen to us. Doctors are even today one of the most trusted voices in the society. And therefore, we should collectively harness the power of doctors to reach out to people, tell them that it's a health issue. Everybody thinks that no, 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 it's an environmental issue. Hamara kya hona hai? Humne to, I've got a air purifier in my house. I've got. So everybody is looking for an escape or a personal solution without realizing that unlike electricity, which you can have from your generator or that inverter, or unlike water which you can carry in a bottle and drink from your personal bottle, air is not something that you can carry with you. If you, Dr. Tiwari, move out and come to Delhi and you land at the airport and you're driving to my hospital, you will have to breathe the air which is there outside. So personal solutions will not work for air pollution, which is a public problem. We all have to collectively do steps which reduces the air pollution. That is the only way. So we need to tell this to people in a concerted way. That's one of the things which Doctors for Clean Air and all of us coming together can do. Dr. Tiwari.
So, sir, it is the health professionals need to be motivated. They should be aware because we, like gynecologists, going to school, but we are talking about the reproductive health. Along with that, I will borrow that picture from you. I will
Yeah.
request you, and whenever we are going for talk to any school, and I can put that in my hospital. So at least people moving there, they will see it. And it is the duty of we all health professionals and collective minded people, not only the pulmonologists, not only the gynecologists, but every individual working in health industry, paramedics, they can also be part of this
Sure.
very, very
Network.
important mission. And it needs really, it's a need of our for the global health to
Yeah.
prevent all this pollution, air pollution, and its impact. Because otherwise, our children, our grandchildren, like we are sharing here, rightly said by you, we can take our water, we can take generate our electricity, but we have to share the air which is available in atmosphere. So for everyone's health, for health of all living organism, we need passionate work like you are doing. Hats off to you, sir.
So
So
I would like to just share, Dr. Tiwari, 7 ways in which doctors can be involved with this aspect. And I'll just quickly enumerate those 7 ways. One is that we can minimize our own impact. Healthcare facilities are one of the highest polluting areas. We use a lot of chemicals, we use a lot of electricity, we use a lot of generate a lot of waste which goes out and gets burned. So in our areas, if we can reduce, reuse, recycle, etc., etc., we will be reducing our impact, our carbon footprints. As you said, charity begins at home. Healthcare facilities, if all the healthcare facilities of the world were to be put together in the form of one country, it will be the eighth largest polluter in the world. So we contribute a lot to the pollution. So we should reduce our footprint. That's number one. Number two, those who are aware of this should discuss it with other colleagues and empower our other colleagues. We should talk about this to our patients. So I actually have made a standee, which I keep in my office also. In polluted city, breathing kills. So when patients are coming inside, they read that breathing kills. So they get confused. Doctor, Sahab, we are alive because of breathing. How can breathing kill? So I then start this dialogue. So that's a way of starting a dialogue. So communicate with your patients that air pollution is a health issue and we all need to collectively work. Engage with the community. As you said, all of us go to schools, colleges, resident welfare association, so many other areas, and we take public lectures. So we should talk about air pollution being a health issue and affecting all of us badly. We all are very media savvy people, Dr. Tiwari. We all have friends in media, and media is one of the most powerful channels. So we should engage with media and write articles, op-eds, etc., and tell them. We also are amongst the most well-connected sections of society. We have connections with bureaucrats, police, politicians, senior people, influencers, people, industry, businessmen. So all these groups where we can reach, we should reach out. So what Doctors for Clean Air has done, now we are going to different cities and we are forming forum for clean air in different cities. So we use the name of the city. For example, if you are in Mumbai, we'll call it Mumbai Forum for Clean Air, which will be led by a passionate doctor, but will have all sections of the society. Anyone who wants to contribute to this topic will come and be part of the group and spread information, do some actions. So Lucknow, Kanpur, Jaipur, Meerut, there are about 25 odd cities where we have already formed these forums for clean air. And I invite your Foxy members who are very passionate about social causes from across the country to write to you, connect with us, and take a lead in forming these forums. So if we get all these policy makers, etc., together, we can do. So this was the sixth part. And last but not the least, we can do a lot of data collection. Foxy has been in the forefront of a lot of path breaking research. So we all can collect data, we can do some research, and thereby generate Indian data. Because oftentimes it is said, oh, this is Western data. We have no Indian data. So it is the duty of us doctors to generate. So I'll quickly recap. Generate data, engage, number one. Number two, engage with the policymakers. Number three, engage with the media. Number four, engage with the community. Number five, communicate with your patients. Number six, empower your colleagues. And number seven, reduce your own carbon footprint. So these are 7 ways in which all of us can be contributing to the topic of air pollution by reducing it. Dr. Tiwari.
So, sir, it is very, very important solutions you told that reuse, recycle, because we healthcare industry generating 1/8 of the this
Huge
thing.
amount.
We need to go back to basic, like to reduce the disposables. We can start using at least mask app which we are using previously, in particularly where we can use ICU and ICU, we can do it that autoclaving and ETO, and we can start doing. So that is also an approach you advise. And that forum, community, healthcare professionals, and media and data collection, particularly Indian statistics, that is really important. For everything we look international people. So if like you are doing so much of this studies and research, so it is really need to generate our own, because we are living in very, very polluted, um,
Cities.
unfortunately, polluted cities. So just want to ask, sir, any government policies or initiatives in India addressing air pollution and climate change, and are we moving in right direction?
Yeah, so Government of India has a very ambitious program called NCAP, National Clean Air Program, which has identified various cities across the country, which are called non-attainment cities, which are highly polluted cities where the air quality is much worse than accepted Indian levels. The government approved levels in India are actually higher than WHO levels. But the reality is that most of our cities do not even meet those higher levels, leave aside the WHO level. So government is doing its part in reducing the air pollution. Various measures like promotion of electric vehicles, the upgradation of the fossil fuels, all these are actions. But I think unless it becomes a public movement, unless 140 crore people of the country realize that air pollution is a health issue, if we are worried about the health of our children, we cannot neglect this issue. Once 140 crore people realize this, then only a kind of a public agitation, public mass movement will happen, and then only the changes will come. Otherwise, the speed at which deterioration is happening and the speed at which the corrective measures are happening, there's a wide gap. And I think in times to come, this gap is going to increase, and we are going to face more and more health challenges because of this. Dr. Tiwari.
So, sir, just one last thing, that any success stories from other countries that we can learn.
So China has done, Beijing, about a decade back, Beijing used to be even worse than what Delhi is today. And they sort of made policies. They put a lot of action. So one message I want to give, that the solution to air pollution is to prevent the air from being polluted. You would have seen a lot of places, some air cleaning devices put in public places. It's all sham. Air is a continuous shed. It does not even follow international boundaries, leave aside state boundaries. So there is no way that you can put air purifiers to clean the air of the whole world. It's not possible. So preventing the air from getting polluted is the answer, not cleaning the polluted air. So we all should take measures. China has done it very successfully. They have brought down the air quality indices very significantly, and we also can do it. And we got a very live example of that during COVID time. When there was lockdown, there was no activity, there were no human beings on the roads, there were only animals, peacocks and other animals on the roads. Suddenly India Gate was looking different. In Punjab you could see the mountains, the air. Suddenly we started seeing the stars. So there is evidence now that it can be done. So it's just a question of attitudinal change. If we take a decision, and the reason to take that decision will come from the fact that it's not about somebody else, it is about your children's health. If you love your child, there is no way you can ignore the topic of air pollution.
I'm so thankful, sir. So it is the joint effort by government, by the people, and every individual. Like
Yeah,
I'm living in Indore. Eight Now Indore is the eight-time cleanest city. What we used to see how they implemented. Initially, there were punishment and so look after by the government officers. Now it is in the habit of people. So like pioneers like you, devoted people like you are talking and spreading this knowledge that is really so much helpful, sir. And for the health of every individual, you are taking care, not only just looking after your lung transplantation, lung cancer surgery. You are giving your precious time for these things. That is really hats off to you, sir. So I'm so thankful, sir, for getting so many good inputs. And I think I'm very sure that all viewers, all gynecologists, those who are watching, and they will be watching through YouTube. Those who couldn't join now
attend
in
today.
the
Yeah.
live because of the clinic times and so much engagement. I'm so thankful, sir, for taking
So
out time.
Dr. Tiwari, before you end, allow me to thank Foxy, Dr. Sunita, yourself, and all the Foxy members for this honor given to me to invite me. And I would like to end by saying that we have this beautiful material called Clean Air Prescription, and also 7 things which doctors can do, which actually is a part of it. I'll be happy to share the e-copies and everything with you. And anyone who wants to become a member can just go to a website, Doctors for Clean Air. It's whole thing, Doctors S for Clean Air.org. And there's a section, join and become a member. There's no fees, there's no qualification. If you're a doctor and you are passionate about this topic, just join and help in your small way. So I would request all Foxy members to become members and contribute to this cause for the better health of our children. Thank you so much.
Thank you, sir. I will share this all details in our
Sure,
Foxy Society. We
sure.
are having 46,000 gynecologists in Foxy. So I wish to join. I wish to become member of this organization, and I really thankful, sir. No
Thanks
words.
to all
Like
of you. Thank you.
it was an eye-opening session, sir. Thank you so much.
Thank you.
Good night, sir.
Good
Thank you.
night.
Thank you, Sunita ma'am, for giving opportunity. Thank you, Foxy. Thank you so much.